Welcome to today's press briefing. We have Dr. Chong Shukwan, Head of Communicable Disease Center of Health Protection, and Dr. Lau Gai-hin. Good afternoon. Last night, we had 222 PCR positive cases, 208 cases from the RAT positive. So today's numbers are 430 cases. So the cumulative figure in the fifth wave, 1.19 million cases, including 740,000 they were PCR positive testers and 440,000 RAT positive cases. So out of the 222 PCR positive cases, 46 of them were tested from the hospital authority, 49 were tested from our CHP laboratories, and 127 cases were tested by private clinics. So we conducted some preliminary DNA tests, and L452R were all negative. In today's cases, 15 were imported, 11 were PCR negative, and 4 were RAT positive. And 4 cases were arrivals yesterday from 2 flights. 3 of them took JL029. One was a reinfected case, and another was from flight AI316. In the other 11 cases, they had arrived in Hong Kong a bit earlier. They were also tested on the 3rd to 5th day. In old age homes or disabled persons' home, there were no new outbreaks, and in the 800 cases, previous cases, we had 2 more new patients, and no staff were affected, and they came from 2 old age homes. Regarding schools, yesterday I said that 13 positive cases and 1 after investigation, we found that the RAT positive picture or result it was not confirmed, and the school conducted another test and tested negative. So yesterday's figure should be 12 instead of 13. Today, we have 8 additional positive reports from the schools, and those include 7 students and 1 teacher. They came from 7 schools. 1 school had 2 students from the same family. So a total of 7 schools reported. Regarding the number of deaths, the HA reported an extra 8 cases. In the 5th wave, HA reported 9,000 cases, and including non-HA cases, there were 9,069 cases in total. So these 9,069 cases, 3,741 were female and 3,500 male. The ages varied from, and mortality was more or less the same as it's before, so I won't repeat the figures, and that concludes today's report. Dr. Lau, I can report on HA. Currently, we have 1,761 confirmed patients in the different public hospitals in North Langtao, the AWE. They are being hospitalized, and there was an extra patient who was in critical condition. 1 patient is in serious condition, and we have 16 in ICU. So 8 reported deaths. They were from yesterday, 5 male and 3 female, aged between 49 to 95. And the deceased patients yesterday, 1 lived in a residential home, 3 did not have vaccination records, 4 had 1 jab. So that means 7 patients had not completed 2 or more vaccinations. And that's roughly 87%. So 1 patient had 3 jabs, 7 patients were 65 years old or above, and 1 person was 49 years old, a female patient. And on the 24th of February, she received the Sinovac vaccine, and previously she had discovered that she had lung cancer. On the 21st of April, she was admitted to Princess Margaret Hospital, accident and emergency. She had fainted and had many falls at home. So after the RAT test, she was confirmed positive, and after admission to hospital, there was a hospital scan, and we had discovered that her cancer had metastasized to different locations in the and she deceased yesterday. And 256 patients had recovered. Those include 170 who have been discharged from hospital. Then in the 5th wave, we had 47,000 patients who had recovered. 46,653 had already been discharged from hospital, and up till now, from the beginning of the year till now, we now have 59,727 recovered patients, and those include 59,000 who had already left hospital. And today, we have not discovered any positive cases admitted to hospital. Regarding staff, 22,331 have confirmed positive. 21,807 have already returned to work, and that concludes my report. Q&A, please identify your outlet, the one in red. I have the following questions. Today, Dr. Chuang said that the confirmed cases, we have an extra 180 cases. So what reasons led to this rise in figures? Is there a rebound in cases? And we already have some AstraZeneca medication distributed to the different hospitals. I want to ask, how many patients have used AstraZeneca medication, and what are their age distribution? And is it necessary to purchase more AstraZeneca medication? And lastly, regarding genetic DNA analysis, when we previously had more than 10,000 cases a day, we were able to do 1,000 to 2,000 cases. And currently, we are in low triple-digit levels. Is it possible to do DNA analysis for each case? Today's figures are higher than yesterday. So we cannot just rely on one day's figure to determine a trend. So even if it is higher, last week we resumed school. We had relaxed the social distancing. A lot of companies are now resuming work. They're not conducting work from home. So that will lead to more traffic flow. We also see more people on the streets now, and there's traffic congestion. So all these are transmission vectors. So if there's a rebound, it is within our anticipation. So we have to see whether it's a large rebound or not. So we cannot just rely on one day's figure. We have to wait and see. The DNA analysis is underway. We are aware the labs are reviewing their capacity.
Regarding the AstraZeneca oral drug, I think they have already been sent to different hospitals, and if there is a need, they will be prescribed to the relevant patients. This is preventive medicine, according to the experts, and they will be administered to people who are immunocompromised. Basically, we are focusing on patients who have received stem cell transplants. The experts are now monitoring the administration of these oral drugs on the patients, and they are monitoring the efficacy of such drugs. And if appropriate, they will stock up such drugs. Now TV. It is reported that Mr. Zhang Kong, an artist, died in the Kowloon Hospital. Has the 6P, receive any information from the hotel? And did Mr. Zhang receive any jabs? And also regarding the reported case, when was it confirmed? Was it confirmed at the place of departure? Yesterday, you announced the list of private practitioners who distributed the antiviral drugs. So what guidelines does the department given? After the patient has consulted the private contractor, does it mean the patient will need to report those cases? Does it mean that the patient will not have to report the cases themselves? Does the doctor have the right to issue the the exemption certificate for the recovered patient? And also, can the private doctors charge a fee? And also, do you have the utilization rate of such clinics? I do not have details regarding individual persons who stayed at those quarantine hotels. Regarding the case reported today, for the imported cases yesterday, 3 came from Japan. So the arrivals yesterday, one arrival was from the Philippines. Regarding the reported case, I think it was actually identified at the port of departure. The other arrivals who came from the US, Singapore, the UK, Germany, and also Taiwan. Regarding the designated clinics and the usage rate, at the moment, the usage rate is not very high. On the 26th, namely yesterday, 188 patients had gone to these clinics for consultation. I'd like to appeal to the patient to make an appeal again that if you are tested positive through PCR or RAT, if you feel unwell, you should consult the doctor as soon as possible. And we have ample capacity at those designated clinics. So if you need to see a doctor, I think the doctor will prescribe the oral drugs to you. I don't quite get your question. Sorry, the speaker's not coming through. She's not speaking in the microphone. If I may answer this question, for the private medical practitioners, if he is treating a patient who is tested positive through PCR, because the reports of all the labs will come directly to us if it involve a positive case. So the private practitioners do not have to submit a report. For the RAT tested patients, if the tests were done by the patient themselves, then the patient will have to report to us. The responsibility of the doctor then would be to remind the patient to make that report. I understand that the private practitioner cannot charge a fee, but I don't think there's any regulation regarding the how the other clinics charge the fees. You mean the exemption certificate for the recovered patients? I think on the website we have guidelines for the medical staff regarding how doctors can actually issue such exemption certificates. Now, I think for private practitioners, after they have prescribed the medicine, they will still have to report to the system. Until the 26th of April, we have 10 patients who have been prescribed by private practitioners the new antiviral oral drugs. 4 were involved the Paxlovid, and 4 involving the molnupiravir. Two questions. The government has announced the list of the number of non-locally trained patients Many of them involve, well-known universities abroad. So would you think that we'll be able to attract these locally trained doctors to come to Hong Kong? And also for the mainland if many of them come from mainland institutions, does it mean that there will be fewer overseas doctors coming to Hong Kong? I think the press briefing basically is about the virus. The HA has announced the first batch of the list of the HA recognized medical institutions. I'm sure that more qualified overseas qualified patients will be able to practice in Hong Kong. The HA will provide support to meet the needs of the various specialties. Cable TV. First of all, regarding the cases reported from schools, I understand that two students come from the same family and they study in the same school. What grade do they study in? Do they study in the same grade? Did they attend school a few days earlier? Is there a risk that their classmates will be infected? And regarding the oral drops prescribed by private doctors, some doctors are worried that if the name of the clinic were announced, then some patients will actually, come to the clinic for consultation, and thus there is a risk of infecting the other patients. Do you have many information regarding such cases? Now, regarding those two students coming from the same family, they have been tested positive today. The families are also positive cases. Well, some of the other students have also attended school before, so we're now monitoring whether or not there is any transmission among the schools. Why do you need the information regarding the grades that they study in? I don't think they study in the same school. After we've collected the information of the private doctors, there will be an announcement, but I don't have the details. The reporter at the front. Economic Times. Regarding the artist who died in a quarantine hotel, is she a positive case? Do we have the age, gender of the patient, and when was she admitted to this hotel? And also, for how many of the students confirmed positive today have they attended schools in earlier? And regarding the imported repositive case, where does the patient come from? Does he or she have to be, isolated? And for the oral antiviral drugs prescribed by private doctors, do you recommend that they consult the doctor in person or through video consultation? Thank you. Regarding the quarantine hotel, the person at the quarantine hotel, I think this has happened today. And all the information that we provide you with today was the information we have up to yesterday. Until he is a positive case, otherwise we do not have such information. I understand that 618 schools have resumed, person-to-person classes. Repositive case came from Japan. 5 of the students attended school on the 26th. 3 attended, school on the 25th for the last time. But they're not on the list of those schools with positive cases. I think they should have some guidelines. Next question.
首先想問翻
the imported case from Nepal, and she was tested positive on the 12th day. Do we have the DNA analysis? Was that a reinfected case, or do we have details? We have 8 positive cases reported from schools, 7 students, 1 teacher. So how many students was the teacher in contact with? Did they participate in high-risk activities, extracurricular activities. The full DNA analysis is not ready yet. Every time we have a positive case, there is a possibility of contact with other students or teachers, so we need to monitor. Just now, it was mentioned school cases, 7 students, last day of attendance. So what was the last day of work of the teacher? So school cases are, the cases are coming down. Is that in line with CHP statistics? So what is your assessment of school transmission? It might not be a teacher, it's just a member of staff. The last day of work was 26th of April. The figures are high and low. It might be related to the community. It's not necessarily correlated. There is a list of 212 doctors who have oral medication. Have there been cases of doctors who were not allowed to disclose their availability? So does the HA have any assessment of the figures? Do you expect a figure of 10? Just now you mentioned that a student yesterday, their case was not confirmed. Now, if they conduct a test before school, and should they return to school first or just assume they're positive? Any recommendations? Dr. Lau said the clinic capacity is not high, so will you reduce the number of clinics depending on the usage or the number of positive cases in the territory? I'm aware that some doctors refuse, but I don't have the particular reasons. We don't anticipate how many private doctors will accept or decline. The student you referred to, if it was unconfirmed, then they did not go to school. That student, yesterday, there should have been 1, not 2. They were attending a special school, and they also live in a hostel, so the staff there will repeat the test. As of 26th of April, 5 p.m., 23 designated clinics have already provided doctors consultation for more than 10,000 patients, and more than 7,000 of them made an appointment through the care hotline for high-risk groups. So you'll recall that the care hotline, it started operation on 15th of March. The HA will continue to monitor the epidemic development, especially with school resuming and people going back to work. So we will adjust our service capacity accordingly. We strive to provide the best care. So the number of clinic visits are very high. We provide service for more than 1 million visits. We provide consultation for a total of 6 million per year. We understand there is a high demand, and sometimes we cannot provide adequate service. So we will keep an eye on the operation of the clinics and deploy staff resources flexibly in order to provide the best care for our targeted groups. Well, if there is an unconfirmed report, there is a chance of it could be positive, and we need to notify the school. So the simplest method, if we have an unconfirmed case, then they would need to conduct another test, because the initial test might have not been conducted adequately or properly. So if under a retest they are tested negative, they can report back to the school and explain why they were late.
好，
Does the government have enough manpower and support for people under quarantine? And how does the government ensure the overall well-being of those under isolation? And what type of support can older people request during quarantine? Thank you.
You mean normal quarantine or quarantine for imported?
Quarantine hotels.
For quarantine hotel, they have staff who look after them. And also for the medical support, and we have also other medical personnel to look after them.
仲有冇其他問題？
Any other questions? If not, we'll conclude. Thank you.